Sarah Scheuermann has been a nursing professional for 25 years, with the majority of her career focused on pediatrics, pediatric intensive care, emergency nursing, pediatric urgent care, and pediatric primary care. For the past 8 years, Sarah's worked as a pediatric nurse practitioner, teaching the importance and safety of vaccine to parents. She is evidence-based and follows guidelines set by professional child-specific healthcare organizations such as the National Association of Pediatric Nurse Practitioners and the CDC and other such organizations. Sarah now lives in Mandeville and is a pediatric nurse practitioner with Children's International Pediatrics in Lacombe, one of Children's International's 22 primary care pediatric clinics. So I think she has quite a bit of experience in pediatrics. In her early career, though, prior to the start of her nursing career, she was a newspaper reporter with the Times-Picayune. So she fits well in with us here at the Press Club. After her presentation, she will entertain questions. However, only members of the working press and members of the Press Club can ask questions. Please silence all of your electronic devices so as to not interfere with her presentation that we look so forward to. So without further ado, Sarah Scheuermann.
Thank you so much for that nice introduction. And I'll just kind of update real quick. I've left my peds clinic in Lacombe, and I will start an administration job teaching the next generation of nurses at the entry level with a local nursing school in Covington tomorrow. So a little bit of a quick update there. And also, I am a small town girl and wish that I wrote for the Times-Picayune, but it's the Picayune Item out of Picayune, Mississippi, where I covered more Dairy Day and Board of Supervisor meetings, so I'm not that fancy, all in all. But thank you so much, and I thank everyone that's helped me to be here as a guest today, especially the National Association of Pediatric Nurse Practitioners, because nurses and nurse practitioners like me come and talk to esteemed professionals like you for one reason. We care about the people in our communities, and we care about children and their families. And that's why I'm here. So without further ado, we're going to talk today and look mostly at using the flu vaccine, because we have a current crisis, and that some of us have chit-chatted about that already, and that is that parents don't know what to think about vaccines, and they're delaying usual childhood vaccines. They're delaying important vaccines like the influenza vaccine that's been around for 50 years and can help prevent, usually about 40, 50, 60, 70% prevention of flu infection, but also can reduce the chance and risk of hospitalization in children when they do get flu, and the same for us. Years ago, we thought that, well, it's only the little bitties and the elderly that die from flu, but there are about 70% of children who die from flu actually were not vaccinated. And so if you told me that 7 out of 10 times that I went to the casino on the Gulf Coast and would win money, I'd be going all the time, right? So that 7 out of 10 kids, that's a big thing when they're dying from not having a basic affordable vaccine like the flu vaccine. And half of those kids are not high risk. This is a research article that came out about 5 years ago, and we'll be looking more into that now that we need to, but they were not asthmatics or diabetics. They are everyday kids who go to school with your kids and ride the school bus. So we can talk a little bit more about that. So my entire purpose today is just to tell you that the vaccines that your kids and grandkids and neighbors' kids, nieces and nephews have been getting need to be gotten like today. If parents are putting those off, we're going to have an issue. Measles are going to pop up. My kids had a rotavirus vaccine where my little 6-month-old baby's booty was bleeding from diarrhea, and that's preventable now. Pneumococcal pneumonia, I saw that in the PICU, preventable diseases. Mumps, I've seen that, preventable disease, and we do not want measles back again. We do not want these diseases coming back and hospitalizing our children. Let's move forward. Again, the organization that I'm with, and we do not have a chapter in Louisiana. We have, and I've been president, immediate past president now, of something called the electronic chapter of this organization, and we have a reach across the entire nation into Alaska. About 300 members, but overall thousands of members in this national organization, much like our physician counterpart organization. All right, and this is just a summary of what you heard, but bottom line is I've done a lot of vaccines in 25 years. I actually used to work with corporate health on the side. When I worked at PQ, I would go and give organizations lined up out the door adults who needed flu vaccines to stay at work, right? We can talk about income loss. When parents do not get their kids vaccinated, their kids are missing school days and they're missing work days. They're missing income. Lost time is huge to employers. I had flu in 2015 and 2016. My flu vaccine missed the mark those 2 years, and I missed about 5 days of clinic time. 5 days of clinic time means 5 days of kids back to back lined up sick during flu season that weren't cared for in a timely manner. And then if parents couldn't get them in with someone else or urgent care, where'd they go? They crowded the emergency rooms. I don't have any disclosures. I'm not fancy. No one pays me for this. I'm here because I love children. I am not here on behalf of a clinic organization or even my brand new employer. I am here to try to help prevent disease in our state. So what do we want to do? We want to help kids fight flu so they can do what they want to do, right? Kids want to be playful. They want to get out. They want to run and jump and dance in sports or chess club or whatever it is they want to do. We need to keep our kids healthy. So this is, starting today, National Influenza Vaccine Week. What does that mean? That means we need to get the word out, and we need the help of everyone here who is in the press or a member of the public that may see this on public broadcasting that can spread the word to their grandchildren's families, to their neighbors' families. Again, word of mouth is very important. We want to remind you that it's ages 6 months and over who qualify for the flu vaccine. So one of the big things that's important is that our mommies of those infants up to age 6 months are vaccinated, and they can be safely vaccinated during pregnancy. We do not need an infant to have influenza. I can tell you one of the saddest things that I've ever experienced and read about, not in our clinic, but is a baby dying on Christmas Eve from a preventable disease, flu. That should never happen. Complications of pneumonia, superinfections, meningitis, all of these things can come from, flu is not a cold, okay? Let's just understand that. It's not a common cold. For a lot of people it is, but it is not a common cold. Hello. There you go. Your statistics are here, and you have these in your little packets if you are with the press. And I'm going to talk baby talk a lot because I've done that for so many years in the pediatric world. So if I talk about your little packets and your little feet and your little babies, please don't be offended. All right. Again, this week is National Influenza Vaccine Week. The CDC has declared it December the 5th through the 9th. Already this year, we've had 14 pediatric deaths. Pediatric means babies, infants, children's, teenagers, right? 14's too many. 14 is too many. We had 2 last week. It doesn't sound like a lot, but when it's somebody you know or your kid, or you're taking care of that kid in an ICU or ER, it's a lot. It's heartbreaking. If you look at pediatric deaths, this is an interesting chart. If you look back 20 to 21, what did we do? We stayed home. We didn't go anywhere. We didn't expose the kids. There was 1 death. Everybody locked up, right? We know what happened. We just beat that horse till it can't even run anymore. But if you look, 21 to 22 people were getting out a little bit more. What happens? The death rate starts going up again. And we are having early flu already. October was terrible locally. Flu was left and right. I can tell you I picked up flu because I delayed my flu vaccine by about a week or two. You know what I did? I took flu and COVID home to my mother and my husband, who are both older than me. Mother's a heart patient. She did very well, but it was a scary time. And so I will always and forever have my flu vaccine the first week of October. Again, I will never put my family at risk. I went into CVS instead of the employer, and they told me to go home and log into the computer, and I didn't do that. But you know what? I'll get myself logged in and get my vaccine next year. It was misery. So overcrowding, again, if you read articles, and I put an example of such an article in the back of your packet, from the East Coast over the West Coast, emergency rooms are crowded. Wait times are many, many hours. I have friends I met with mid-November on a nationwide call with other nurse practitioners in clinics, emergency rooms, ICUs, and wait times could be 15 hours to get to a bed. Let me tell you what, today's parents are impatient. They're used to an instant something. If they are told that their triage time is 3 or 4 hours and they have a sick kid, they may not wait to be seen in that urgent care or in the emergency room or even in their primary care office if it's backed up, and that does happen. So the important thing is that we reduce wait time in these clinics and facilities like hospitals. How do we do that? The one thing we can prevent, we don't have an RSV vaccine developed and ready for the public. RSV is a horrible, horrible little common cold to a lot of kids, but I saw many children on ventilators when I was in the peds ICU, many babies for pulmonary suctioning, meaning their lungs were filling up with fluid. So RSV, we don't have anything. COVID, we're not even going to go there today. Thank you for coming. We're not going there. Y'all know more about it probably than I do by now. Everybody knows about that. But what we can do is take care of our vaccines. Flu vaccine we've had around for 50 years. We know that can cause a little fever for an hour or two or 6 hours or a day. That's usually because the body's developing an immune response, but it's nothing like that other responses. It is a safe vaccine. It cannot give you the flu. It is needed to relieve the overcrowding because we have an explosion of respiratory viruses coming into these emergency rooms. Kids are not getting timely care. And if it's a community hospital, not a children's hospital, guess what? You're not getting in timely. It used to be if we said shortness of breath and chest pain, you went immediately back. Guess what? There's not an inch in the hallway in some of the hospitals to pull you back. And if you're with the press, your homework today is to go home and call your local hospital and ask them what their wait times are and see how we're doing here in Louisiana. If you don't want to do that, give me an email. My email's in there, and I'll call and get some information for you. This is the severity. The good news is we're at moderate severity right now, or at least at the end of last week in Louisiana. But if you look around us at our neighbors, what is it, Mississippi, Texas? It doesn't show very good on here. But this is nationally. And here we are in Louisiana. Hey, Baton Rouge, y'all doing pretty good, right? That's good. The yellow is moderate. This is not the high. Going back to national, Louisiana is high. Sorry about that. And you are moderate here in Baton Rouge. So let's keep our hands washed and getting the vaccines, encouraging get it to all families that you would know. It's not too late. It was too late for me the first week of October because I was out and about too much and am ashamed that I didn't get my vaccine. But you know what? If you don't have it, it's not too late. Even though I had flu, and it was weird because it was a flu B, and that's not the prevalent one right now, and COVID, as soon as I was better, I went and got my vaccine because I want to be covered for flu A. Flu A is usually the most prevalent, especially this time of year. That's the one I had in 15 and 16 and missed a week of clinic work because I couldn't get my head off the bed. I was miserable. I don't like flu. I'm very passionate about this one. And we discussed the highest risk of death, but this is not the total population for kids. Healthy, normal kids do die of flu at times. And I don't want to put a scare tactic on you. That's not how I roll. That's not how I teach my parents in clinic. but it can happen. So we do need to know it's not just a cold. When we walk into a clinic room, I can almost tell you that kid's got flu during flu season without running a test. They're laying down horizontal on the bed. And if it's the height of flu season, you see those horizontal kids, they look miserable. They're not drinking liquids, their body aches. They're not sitting up chit-chatting like my little strep throat kids. They're horizontal and they're miserable. So what do we want to do? We want to encourage all of our Louisiana residents to get vaccinated, especially the pediatric population, to take those kids and get vaccinated. And remember that it takes about 2 weeks to develop immunity. So that means if you go today and get your flu vaccine, if you've put it off, or if your nieces and nephews or neighbors or whatever children you know in your life have been delayed for their vaccine, please go and take them to their primary care clinics or to a vaccine for children location and get the flu vaccine. That gives them enough time before they come in and gather with grandma, great-grandma, my newborn baby, grandbaby that's coming January 1st, my first grandchild, and other high-risk population during the holiday, because we know we like to get together as a family in Louisiana, right? We do. But what we need to do is protect the elderly, protect the children. And what child wants to be sick on Christmas Day and not enjoy opening presents? It is not too late to go get the vaccine today, tomorrow, the next day, whenever you can get in and get your immunization throughout your body to be protected and also protect the others around you. There's some key points. You can look at those when you go to look in your folder. One thing that I want to touch on briefly is there's antiviral drugs. How many of you have heard of Tamiflu? Yeah? So Tamiflu, some healthcare providers prescribe it and some do not. I'm a fan of it because I have mentioned that I've had flu before and it just seems to cut it shorter and a little less severe for me. It's not a cure for the flu like an antibiotic's a cure, but it does help so that you're not shedding and spreading the flu germs all through the house to your family or in the car, in the grocery store, in places you shouldn't be with the flu. It does decrease that viral shedding and cuts it short, but it's not without drawbacks. A lot of kids get nauseated. A lot of kids in the literature, and I've seen one or two in my years of practice, do have some hallucinations or poor sleep. And basically we tell the parent to stop the medicine and that goes away. So that's a parent decision, but for the high-risk kids under the age 2 especially, the CDC does like for us to give that. It is protective and it's recommended. So the recommendations are out there from the CDC for Tamiflu. And that's a decision that everybody would make with their own primary care physician. If you can look to this box, the number of flu hospital admissions reported during week 47. That ended last week, almost doubled compared to week 46. This is an early onslaught of flu. Usually we see it like right the week before Christmas, Christmas week. We just really start seeing it. I think I have a slide. Nope. I think 2017, 2018, that Christmas holiday time for kids. I was at Children's Hospital in New Orleans working after hours clinic. We had a Christmas party planned for say 7:30, 8 o'clock to leave early. There was no leaving early. It was midnight when we got out of there. There were kids just waiting, coughing, miserable, sick. And here's the thing, your kid may not have flu when they're in the urgent care. They may come in with another virus, RSV or adenovirus, another type of virus. But then if they're sitting in the wait rooms for 3 or 4 hours, they're picking up something new to take home, right? That co-infection is not fun, trust me. If you have any questions, I've put some locations up here that you can go and look. I also have my email if you need to reach out and ask any questions. If there's any time when you need a pediatric advanced nursing opinion on something, please let me know. If I can't get the answers to you, I have lots of friends throughout not only Louisiana, but whatever, statewide, nationwide that we can reach out to. We have a great organization. There's a website called Shot by Shot, and this one tells stories. You can go in and filter by infection, different types of infection. You can filter by state, you can filter by age, and you can get the stories, the unfortunate stories of people who did not, and children and infants, teenagers, who had poor outcomes from the flu. So we don't want to play that in here publicly, but if you're interested in knowing that this is real and this is not just a cold, you can go and kind of check that, and it serves for other illnesses as well. Do we have a question?
Yes, just in terms of if you're a family that's less resourced, does the CHIPS cover any rural areas? Is access any issue with our supply chain because of whatever?
So it's a very good question. I'm glad that you've asked that. Vaccines for Children is your Medicaid branch for the underserved children in Louisiana, and we have not had a supply issue that I'm familiar with of the vaccine. We have had supply issues of some common medications, and this is nationwide. Amoxicillin, have y'all heard of that? It's the pink stuff, right? Common for strep throat, ear infections. We had a short supply dip for that, where we just couldn't get it, and we had to be more judicious. One of the things that we use, one of the terms that we use is antibiotic stewardship. That means that people with a prescription pad, physicians, nurse practitioners, physician assistants with prescribing privileges, they have to be very careful not to overprescribe these medications. Not only is it not good for the child because they can build resistance later, but they can also deplenish the supply when we have a huge unexpected outbreak like we're having right now. So not so much with the supply of the vaccines, with vaccines for children. And if I find out I'm wrong, I'll definitely get that message back to you. But what we have seen augmenting the nebulizers, the little solutions you put of albuterol, the generic drugs, they're just, when we have a huge spike and it's early, we deplete the supplies, and it takes a week or two or a couple of weeks to catch up. When I had the flu and COVID at the beginning of October and I brought it home, they prescribed me Tamiflu, but they prescribed a preventative Tamiflu dosing for my mother, who was 78, but a heart and patient diabetic, very high risk. And they filled mine, but they would not fill hers. They said that they were out of it at our pharmacy, and it would be a week. And it was a week, but unfortunately, I just gave her mine on the dosing. I hated to do that, but it's more important that my mother was protected at that point in time, especially with COVID in the house as well. So very good question. Thank you. Yeah.
When you said 14 children had died so far, did you mean in Louisiana?
No, ma'am, that's nationwide. Mm-hmm. Yes.
You said that people don't know what to think about vaccine. Perhaps it's a stupid question, but why is that?
I think that the past couple of years have confused a lot of parents. Every parent that I know, I think, wants the best health care for their child. There's a few outliers. We've all met those in our lives. But parents want what's best for their child. But during the coronavirus crisis, pandemic, we had conflicting messages. Physicians disagreed with each other. Pharmaceutical companies were telling us one thing. It was a new experience for us nationwide. And we were getting bombarded with so much information as parents, as providers, the news media, that we didn't know what to believe. And we had to sort through this much information, right? So now parents are confused, partly with social media, partly with word of mouth on the playgrounds or at PTA, and they're rolling that confusion over to proven childhood vaccines that have saved lives. And they're projecting some of that confusion onto other vaccines. They've really got into researching and trying to make up their own minds. The best thing for these parents to do is to go to their primary care provider and schedule an appointment and sit down and talk to them and get the information, get the facts, and get reassured from their primary care provider, because I can't think of many in pediatrics who would not recommend basic vaccines, like our kids all got to start school, right? Some vary a little bit on influenza vaccine, but that is a very good vaccine. It's been around for 50 years, protecting families, reducing risk of hospitalization and death. So that is just, thank you for that question.
To follow up on it, does this come to like basic R&R kind of vaccines too, that reluctance?
The reluctance is going to other vaccines. So we're finding that our our enrollment for school vaccines, school shots, shots for tots, infant vaccines, parents are delaying those, and they fell behind during COVID. When I was in Lacombe, Louisiana, in that little bitty, beautiful fishing village that I loved, full of children, they weren't coming in 2020. They were not getting their vaccines. Now, we encouraged them, if you want to meet me in the parking lot, I would go out to the parking lot for little bitty babies, but you've got to get the babies vaccinated. But parents were thinking, we're not going anywhere, we're not needing the vaccines. They were all delayed. But we've got to get back on schedule. The delayed vaccines have to get back on schedule. We're going to end up having rotavirus. We're going to end up having measles outbreaks, possibly. We're going to end up having more strep pneumoniae, more pneumococcal disease. All of these things lead to meningitis, severe urinary tract infections, and pneumonia and death, okay? So we've got to get our kids in Louisiana back on schedule.
With so many new medicines and vaccines and coming out and so many different viruses, what's the scale like it used to be of these viruses becoming resistant to these things? Is that a possibility of it happening again?
So we're not seeing resistant diseases resistant to the vaccines at this point in time. What we are seeing resistance to are antibiotics. So medications that would be covered traditionally by something like amoxicillin, if we give it too many times over and over for every time they pull on their air to comfort themselves to sleep, this isn't always ear infection with babies. Some of them do this as a comfort factor. If they've got a runny nose, every time they have a runny nose with a low-grade fever, we cannot give amoxicillin because they can develop a resistance to that. And then look what happens, even with supplies, if you went in and you really truly needed that medication, it's not available, you have to go to a stronger medication. Let's call one out like ceftonir or clindamycin, stronger, right? Broader, not more specific. Then you're definitely using the big gun antibiotics that are held out for big gun diseases and infections, and you're developing slow resistance to it through the years. We may not see the outcomes of all that for the children right now, but we do have antibiotics resistant diseases in the hospital. Staph infection, have y'all heard staph? That's where you get the boils on the skin, that type of thing. A lot of the antibiotics that traditionally treated those are resistant. Some infections that were traditionally treated with something, the pink stuff, the amoxicillin, they're becoming resistant as well.
Then the vaccine is different than some of the other medications.
Yes, sir.
Get the vaccine, but be a little leery before you go take extra strength or something like hearing.
Yes, sir, absolutely. So be leery of overuse of antibiotics. Please listen to your provider, your physician, nurse practitioner, your physician assistant when they say, this looks like a virus, go home, let's treat it with a little Tylenol, some fluids, some rest. If you're not better in 3 days, let me see you back. If it gets a lot worse before that, if you're not drinking enough to go TT every 8 hours, again, pediatrics, come back and see us. So they'll give you guidelines, but I promise you, your pediatricians here in Louisiana care about your kids and your grandkids, your nieces, your nephews. They care about the kids of Louisiana. We've got to listen to them and stop listening to social media and stop listening to the other mommies on the playground, okay? You go to the experts. If I needed an attorney, I met an attorney earlier, I would go to an attorney for legal advice, right? If I needed someone who could tell me how to get started as a reporter or as a journalist or how to handle those tough politicians. I don't know. first of all, hats off to you guys for your work. You're fabulous. Thank you. I would go to the expert for advice. So expert advice, even as nurse practitioners, we are experts in pediatric care. We do the research, and when we don't have the answers, we go and get it for you. We get it from evidence. That means they'll take thousands of research articles, pull it all together, and get what works best to keep kids healthy. That's called evidence, and that's what we build our practice on, just as your physicians, just as your physician assistants. It's called evidence-based care. That cannot come just straight from social media or from somebody next door or from the mother-in-law. Hi, you have a question?
Yes, we hear a lot about, we seem to hear a lot more about side effects. You've been in this 25 years, you say. Have side effects increased, decreased, or about the same?
So when it comes to usual childhood vaccines and flu vaccines, they're about the same. There are side effects, and we do have a few outliers where you may get a vaccine and there's a side effect. And there's a vaccine injury reporting database, and we have to legally, by law, we report that. If the parent reports a side effect, or we see it, or we follow up on that, that goes into that database. That is a legal obligation, so we can follow side effects. One of the things, though, side effects are a little bit different from expected reactions. We know that the DTP, the little shot for diphtheria, tetanus, and polio, little kids get going into their 5-year-old, 4-year-old shot. For some reason, those kids always get a hard red arm. So we know, put a compress on it, give some Motrin, it'll get better, okay? We know that after we get a flu vaccine, sometimes we're gonna run a little bit of a fever. That is an expected outcome of that vaccine because the body is building up the ability to antibodies to go and fight future flu infections. So that one's really important too. So side effects aren't changing that I'm aware of. The vaccines are improving, and we're getting more vaccines. They're working on an RSV. How many of you have ever heard of RSV? Yeah, that one was, I do not like RSV. I had an RSV baby last year that I brought to my clinic every single day for about 4 to 5 days. The mom needed extra help. So I brought the baby into my clinic every day, and I would stay late to suction that baby's little nose and to make sure the baby's oxygen levels were good. Didn't need to be hospitalized, didn't meet the criteria for that. This is a viral infection, but I kept my eyes on that child because RSV is something serious. So when it comes to vaccines, I'm hoping that's the next one out of the gate for all of us.
Could you say just a little bit more about RSV? What is RSV?
So help me if I mispronounce this. We have another expert on the physician side of pediatrics. Retrosyndactyl virus. Respiratory syncytial virus. Thank you. I'm from Mississippi. I can't even say peanut butter half the time without messing that up with my draw. So it is a virus. That means antibiotics are not going to help it. But what it does, it's like a cold. So with a 17-year-old kid, it's a cold. But when they give it to an infant or a toddler, it creates thick, copious, meaning tons of secretions. And you're eating lunch. We won't go too deeply into that. But the problem with those secretions is they're not only thick, they're sticky. So they're hard to get out. And you know, babies can't automatically blow their nose and all. So you've got thick secretions going down the back of the throat, staying in the airways. And without a little suction, if the parents don't know to use a little bit of saline and a good little suction bulb to get that out, the babies can fill up with mucus, and that's what leads them into a lot of times a viral pneumonia where they're breathing fast and hard and their little ribs are pulling in. So babies have a very short reserve on their ability to breathe and to keep their lungs clear. And when they do this for too long, pulling in and out, and parents don't always know what's a red flag and what's not if they're not taught or they don't have some information in front of them. The babies just poop out and they quit breathing. It can happen really easy with common viral infections. Yes?
I have another question. What about, do you recommend masks at all for flu prevention?
I think if you're in a high-risk category, for my mom, if we were taken her out and she wasn't vaccinated for flu, I would recommend a mask for her right now, because flu is high right now. But that's not a lot different from what we would do before COVID even came around, when we would just stay home a little bit extra if we were older, or I'm not going to the Christmas party because I know 3 of my nephews have been sick all week and the mama's bringing them, you know. So, but if you have to go to the Christmas party and you know the flu could possibly be in there, then a mask would be okay. But what a hot topic. Yeah, that's a hot topic, thank you. So I think it's an individual decision-making choice. I think every adult in Louisiana by now has enough information to make their personal choice on that. But I can tell you we did not have infections. If you look at that 2020 chart I had earlier, we did not have all these respiratory infections. But what happened, we got back in the mainstream. The body wasn't prepared. It didn't go through the natural courses for these kids, and we have an explosion of respiratory infections. So the experts are all trying to figure that out. Yes, sir.
You said we have an explosion of respiratory infections.
Yes.
Present day?
Present day. So it peaked early, and if you look back at the, there's an article in that blue thing. If you look back at statistics, even from New York and the East Coast all the way over, we have overcrowding situations. That's where I was talking about. When I talk about the wait times of 15 hours to get to a room or to get out of the emergency room, or a 3-hour wait to see physicians, or 4 hours in urgent cares for kids, that is because we had an explosion of respiratory viruses early, and a lot of them. So whatever we did in 2020, that's great, but that wasn't real life. That's not how we can live the rest of our lives. Kids need to see smiles. They need to get out and play. So now we're doing that, and their immune systems are not prepared for, they just didn't go through the natural progression of what they needed to develop an immunity. And so now it's catching up. They're just playing catch up. So hopefully next year we won't have this many. And I think that you can check even with Lady of the Lake and the ER director there. I don't mind giving a call if I need to see what their rates are looking like now. But it's going to pop up really big at Christmas again too.
So when you say respiratory infection, do you put that in the same class as the flu?
Flu, I'm talking mostly about viral respiratory. So we're talking about flu, RSV, adenovirus, enterovirus, even those viral infections, coronavirus. Do you know coronavirus was here before COVID, right? Coronavirus as a name, that type of virus has been around for many years. It's the COVID-19 strain and beyond that just got so crazy out of hand. But, you know, my respiratory panel reports 5 years ago would come back with coronavirus as a cold.
On a personal level, I've experienced just within the last month, many of my friends and acquaintances, I say many, upwards of 5 or 6, have all gotten sick. They thought they had the flu. They questioned whether they had the virus. They did not have the coronavirus. They got tested. They thought they had the flu. They did not have the flu.
Yeah.
They had a small fever for a minute, and that was it. But then they were just sick with a respiratory upper chest.
Yeah.
Is
So
that something that's common?
that is common. Very good question. That's common not only with adults but kids too. So you can have flu-like symptoms and a flu-like illness, and those are counted in those statistics. But it's not always going to be COVID-19, and it's not always going to be a variant, and it's not going to be flu all the time, because some of the more common ones are adenovirus is a big one, and that goes around and that gives you the flu-like symptoms. It is not a good one, and it can make you feel really nasty too. That puts kids in the hospital. So there's a whole mirage of viral respiratory illnesses. We call it a respiratory panel that we get back from the lab. Unfortunately, with the labs, when they're overcrowded, because there's overcrowding of clinics and ERs, sending out panels, it can take too many days to get back, more than we prefer. But when you get those back, then you can see a mirage of different viruses, and there may be 20 different viruses on a panel. So possibly they had one of those, or they had been exposed to COVID earlier and had a little resistance, or they had a flu vaccine a couple of years ago that covered the current strain. I don't know the answer without a panel, but that is common for kids and adults.
Is
No. So fever can come with any illness, and it really comes with a lot of those viral illnesses. Kids can get fever 102, 103, 104. They react like this with fever. It doesn't always match the severity of the illness. What we look at in pediatrics is the behavior of the child and the overall child. So it scares us to death as parents, right? I can remember taking my baby in with 104 fever. It's scary. But what we can look at is if you're given Motrin and it brings it down, and in between bouts of higher fever, the child's playing, they're drinking water, they're wetting their diapers, they're talking, they're alert, then we're pretty much okay. It's when our kids, we look at them when they're wheezing, they're breathing harder, fast, the fever's not reducing, that's when you need to get them in quickly, okay? Those are some of your what we call red flags to get kids in. But fever in itself doesn't always scare us. It scares parents, and rightly so, because we love our babies so much. We don't want anything to happen. But a lot of the viruses do come with fever, not just influenza. Yes, sir, Mr. John?
I know it's, since we have a high incidence of flu across the whole country, or most states, is there any likelihood, or maybe you do it now, where quarantine gets put into effect and for the flu? What would that do?
I don't think that the government is going to try to quarantine us again. I think they're, oh my goodness, I don't see that. But what I do see is when there is a high rate of community flu, we're just not as likely to go to Walmart and grab that buggy handle. So one of the few good things that came out of this pandemic is everybody in America has learned a little bit better techniques for infection control and prevention of disease. They know more about hand washing, hand sanitizers. Stay home when the rates are high, so you can watch the news media. You can go to the CDC website that I gave you, and you can watch the rates. You can even go to the Louisiana Department of Health. They're on this for flu too, and they give you week by week rates. And when you see the number high, if you've got an important event coming up, I have a wedding to go to in 2 weeks, and I have my first grandchild coming in January. I'm not going to Walmart, okay? I'm not hanging out there, right? I'm not wearing a mask, but I'm just not going to Walmart. I'll just get my things delivered, and Walmart does have grocery delivery. But I'm not paranoid either. I'm here today, and I've met some great people. One more question?
So during that period of time when you know you have the wedding coming up in 2 weeks and you're not going to go to Walmart, is there something that you're going to be putting into your body on a daily basis to build up that immunity?
I think it's not going to hurt to take a multivitamin every day, some vitamin C or something like that. I take a multivitamin, a women's Centrum over 50. I'm not getting paid for that endorsement. It's just what's on my counter right now. So it's not going to hurt to do that. But I think basically the good virtues of health. Get plenty of rest. Don't stay up all night Netflixing. Drink plenty of fluids. Stay healthy. Walk every day. Get fresh air. Eat healthy. Don't throw... Well, we'll talk about that later. Anyway, thank you so much for your time today. It's been such a great pleasure.
Thank you, Ms. Scheuermann. Just a reminder, next week will be our last press club for 2022. We will return on January the 9th. Thank you so much.
Who's the guest?
Don't know yet.
Man.
Show us.
Yeah.